So welcome to the 13th Annual Air Quality and Health Workshop here at the Heart and Lung Fest here at the Sheraton Wall Centre in Vancouver. My name's Chris and I'm with the BC Lung Association. And with me right now I have Dr. Michael Brauer. He's a professor at the School of Population and Public Health at UBC. He's also a veteran of the Lung Association stair climb, where he's brought his little kiddies out and climbed the stairs right here at the Wall Centre in support of the Lung Association. So we thank him for that. But today he's done a talk on the burden of disease from air pollution. So we're going to talk to him a little bit about that. So why don't we start with telling us what is the burden of disease?
So burden of disease is really a way that we quantify health and disability, and many people can easily understand that we can count numbers of deaths. Mm-hmm. That is one good way to measure health, but we all do have to die. So another way is really to also quantify what about their health sort of when we're alive, and we use a measure for that called the DALY, or Disability Adjusted Life Year. Okay. And we can think of that as that's the sum of the years of life that would be lost to dying prematurely. So that's that mortality part, as well as the years of life that we live with a disability. So for example, if we have lower back pain, that is somewhat disabling, we can quantify sort of how many years we might have that lower back pain and the level of disability that goes along with that. And the sum of those two, so the years of life lived with disability plus the years of life lost prematurely to dying early, is the disability adjusted life year. And you can think of that as sort of one disability adjusted life year is one year of lost healthy life.
Okay. So what would you say the role of air pollution is to this?
Right, so what we've done in the context of a very large global project is to quantify the role of air pollution relative to almost 80 other modifiable risk factors. So things like physical inactivity, dietary factors, occupational exposures, and we really want to see what the numbers are related to air pollution and also how air pollution ranks. What we know is that globally, the latest analysis in 2013, an estimated 2.9 million people died prematurely from air pollution. That's outdoor air pollution. Another 2.9 million people died prematurely from what we call household air pollution. So that's cooking over an open fire, which is primarily done in rural areas of developing countries. So together, those two are actually the fourth highest risk factor for disease burden around the world, which I think is really surprising and quite shocking to most people. So the things ahead of that would be high blood pressure, smoking, and dietary factors. But it's air pollution, it really is among the top killers in the world and among the top risk factors. And even in a country like Canada, which is very high income and actually has really relatively good air quality relative to most of the rest of the world, air pollution is still around the 10th or 11th risk factor for mortality in Canada, and our estimates are that around 9,000 deaths per year are attributable to air pollution in Canada. So it's still important even in a relatively clean setting.
Wow, that's staggering stuff. What are some other heart and lung diseases that are affected by lung pollution, or sorry, air pollution?
So in this quantification, we are really focusing on the heart and lung diseases where we have really the strongest evidence that air pollution causes them. So these are things that have been well studied over the last 20 to 25 years. And these would be ischemic heart disease, so that's primarily heart attacks, stroke, chronic obstructive pulmonary disease, so that's bronchitis and emphysema, lung cancer, and then acute lower respiratory infections, which it's mainly pneumonia, affecting both adults as well as young children. And so these together are what go into that 2.9 million deaths estimated for 2013. As we know, there's emerging research, which is really the subject of the workshop this year, showing many other diseases also being affected by air pollution. And I would expect that as we continue to update this analysis, we're going to be adding more to this total number when we start quantifying the impact of things like diabetes, things like development of asthma, that we are really getting much stronger evidence now that are affected by air pollution, and perhaps in the future also things like premature birth, low birth weight, or even some of the mental health impacts that we're starting to see being related to air pollution.
Wow, that's good stuff in there. That's all the time we have right now. So I'd like to thank Dr. Michael Brauer for being here with us. His talk on the burden of lung disease as it relates to air pollution will be available on our website. We'll have that deck available. And that's it for now. Thanks a lot.